and welcome to Skincare Confidential, the podcast dedicated to giving you a 360-degree view, an insider's view of the industry of skincare. And I am Dr. Ted Lane. I am your host today, and it is my great pleasure to introduce Dr. Mary Lupo. Thank you, Mary, for being here.
Thank you, Ted, for the invitation.
Absolutely. Dr. Lupo is the owner, founder, and director of the Lupo Center for Aesthetic and General Dermatology. She opened that in 1984. She also is the director and founder of the Cosmetic Bootcamp meeting, starting in 2005 and held annually in Aspen, Colorado. I went this year. It was an amazing meeting. She's a former president of the Women's Derm Society. She was on the board of directors for the ASDS, and overall an absolute key opinion leader and go-to person for anything regarding cosmetics and in the aesthetic industry of dermatology. So Dr. Lupo is a wonderful person for us to discuss the history of aesthetics in dermatology. So again, Mary, this is just, I'm so excited about this because I started my practice in 2006 and it was really kind of I thought it was the heyday of fillers and toxins and everything from there. But we're going to be able to go back in time and you're going to tell me what it was like to practice, really, I think that Botox in terms of the Carruthers doing their studies on the aesthetic use of Botox was in the late 80s, maybe?
Yeah, they really started to talk to other doctors about it in about 1992. I went to the very first ad board. It was at an AAD meeting in Dallas. And it was somewhere between 90 and 92 that they had that meeting. And we all kind of looked at them. We weren't sure. We thought it was a good idea to be injecting people with toxins. But I actually injected myself as my first patient. It was in 1996 that I injected myself with Botox. I spocked my eyebrows, but it was a learning curve, and very rapidly, I think Al Kligman, who, as you know, was the inventor, the patent holder at Penn for tretinoin, which became Retin-A and Renova, and he said that it takes years for scientists to validate and prove the observations of practicing physicians. So that's sort of like a hash of a quote. But his point was that when you're in the trenches and you're treating patients, you sometimes realize things and then bring it to pharmaceutical companies or tell pharmaceutical companies about it. And that's what happened with the Carruthers. They were doing a blepharospasm treatment and noticed that the crow's feet on that side improved. So they extrapolated that observation and brought their receptionist in, and they injected her corrugators to get rid of her frown lines. And as they say, the rest is history.
I mean, especially for Allergan, right? Which really was an eye company at that time, had botulinum toxin used. I mean, it was approved in 1989 for strabismus and blepharospasm. And as you said, that's when, Carruthers and others started realizing that, hey, this has some cosmetic aspect to it as well. And it really changed that company altogether.
Completely. And they became and arguably still remain the leader in what I call non-surgical rejuvenation, because they have so many. I was also one of the principal investigators in 2004 for Juvederm. Before 2004, we only had Restylane as the HA. And so Inamed was the company that had Juvederm. And I was one of the principal investigators with Leslie Bauman and on that original study in 2005. And yesterday was National Juvederm Day, which was interesting. And then when it was FDA, approved, I don't know what they call it in Australia, when it got approval in Australia, I actually was the physician from the United States that went to Australia to introduce it in a big symposium that Allergan had for their lead injectors of Botox to teach them about the Juvederm.
So just going back to Botox for a second, and now as we've, Botox, of course, then Dysport. Now we've had multiple other toxins that have been approved, most recently daxibotulinum toxin, which is, of course, Daxify. What are you excited about right now in terms of, are you excited about Daxify? Has it reached your expectations in terms of its longevity? And what are you thinking about in the future?
So, I was on the study for Revance for the Sakura. I think I was on Sakura 2,
Okay.
which was there was Sakura 1 and there was Sakura 2. And it clearly in the glabella area at that double dose
Yeah.
does give improved longevity.
Mm-hmm.
The problem we're seeing is we're all now extrapolating that information to the forehead, the crow's feet, and other areas. And what I'm not seeing is a similar duration in those areas. So I'm sort of in a quandary right now at this moment in time as to exactly how I'm going to add the Daxify into the system because, people want to have all of it done all at the same time. And I can tell you, I personally typically do 50 units of Jeuveau is my personal favorite, works the longest and the best on me.
Okay.
And so I typically do 50 units to glabellar, crow's feet, and my frontalis. That's my usual routine. It will typically last me 5 months.
Okay.
And the DAXI with 100 units is not going to give me that because I'm already getting movement at about 3 months because I did it in May, June, July, August, and I'm already getting. You see a little bit of movement there,
Yep.
and I don't get that at 3 months with Jeuveau.
Interesting.
So it's been difficult for me to incorporate it because of the increased cost to my patient. My goal is always to do the least that makes a patient look and feel better about themselves. And I don't want to, I'm not a terribly aggressive physician in dosaging. And I certainly am not that way with fillers. I am a incremental mover of the needle. I tell people I turn the clock back, but I do it incrementally.
Yeah.
And it keeps ticking forward. So it's a constant battle and forth. But, I use myself as an example because I'm going to be 69 next month and I haven't had a facelift.
Mm-hmm.
And I've done this all with toxin, laser, and to be honest, a lot of Sculptra.
Mm-hmm.
Sculptra's been my personal main filler, but I don't think I don't consider Sculptra a filler. I call it a biostimulatory device. And because it works completely differently. And I've always had pretty high cheekbones, so I don't need volume there, but I need not to look gaunt.
Yeah.
And as we get older, if you have strong bone structure, you tend to start looking a little gaunt. And I told one of my friends once, she came in and I looked at her and I said, "You're looking a little gaunt." And she joked because we're children of the 60s. She says, "Gaunt, isn't that what we're going for?" And I said, "Not anymore." So sculpture. But really the art of all of these tools is the hands of the person who's doing them. Because I know people who get great results with Daxify, great results with Dysport, great results with Xeomin, Botox, Jeuveau, you name it. So you really have to trust that the physician is going to do for you what they believe that you need and that's going to give you your best results in their hands. And then it's your job to just go to someone who's trained, board certified, and has your aesthetic eye. I don't like excessively done fillers. So women who want that tend to find a physician who'll give them that. It's like a different style of art. It's impressionistic or cubist. And I always say, I want to have the person give the impression of youth and vitality. I don't want them like a cubist where they concentrate on the mouth or they have the eyes, like a Picasso.
Yeah, there's no balance.
Yes, you want balance and you don't want to overemphasize any one particular feature excessively. So, people find the people who will give them the result that they want.
And to your credit, Mary, I know you have been talking about balance well before balance became even kind of popular in terms of cosmetic. I feel like we were so focused on either the cheeks, first the nasolabial folds, then the cheeks, now the lips. But you have forever been saying, no, we need to be balanced. We need to be balanced in the way we inject. So and now people are starting to listen, and
Yeah.
we are trying to get to that. And I feel, in Europe, I've been to a couple of meetings recently, cosmetic meetings in Europe, and that's all that they talk about is balance. Don't overfill. These are great techniques. Let's use the filler. Let's use the different needles to get to that very natural look. And thankfully, in the United States, we're getting to that aesthetic point. I feel like,
I feel like it's getting better.
yeah.
Social media has done a lot of good, but done a lot of harm,
Mm,
because everyone wants to, it's almost like the ultimate watch me. And it's almost, some of these people are like, I make the analogy is they're like train wrecks. You can't turn
hmm.
away because they look so ridiculous, but it's their currency, if you
Yeah.
will, to look ridiculous, because that's why people look at them in the first place.
Oh, right. It's a good point. It's a way to gather attention.
Yeah.
Yeah. Well, it's interesting right now with the toxin world. You're exactly right. It seems like some people, respond very well to Botox. Others respond much better to Dysport. There's Jeuveau as well. It's nice to have all the different tools in our toolbox so that we can personalize to the patient. I think what's really interesting now is there's some companies using AI and apps so that patients can take photos of themselves, and over time you can see when your toxin is really wearing off, and then you might go in and have a different product, and then you can really compare because you'll have
Mhm.
standardized photos done at certain endpoints so that you can really learn individualized about yourself which toxin lasts the longest. And one of them that I know about is called Love My Delta, which is a really interesting app. And I encourage people to look at that. It encourages you to take photos of yourself after a toxin treatment, and it's called Tox On, Tox Off. And so it'll show you when your toxin is wearing off, and that's an indicator for you to think about, okay, now it's time for me to make an appointment. So we're really getting to the point now where patients can kind of use their phones and technology to determine when it's time for them to come back in, and then decide which product works better for them individually. Sculptra, you mentioned, Mary, I think that was 2004 for
Yeah.
HIV lipoatrophy
Yeah.
initially, right?
And we immediately began to use it off label in aging in 2004. We were demonstrating Sculptra techniques at that 2005 boot camp.
Oh my gosh.
Yeah.
Wow.
And we were also doing hyper blended Radiesse in the hands with a cannula in 2007.
I mean,
We did that at boot camp.
this is incredible because really hyperblended radiesse for the neck and other areas, obviously in South America, it's been in the literature there for quite a while, but really last 4 or 5 years here is when we've been thinking about it mainly. And you were
Well,
doing it in 2007.
yeah. We did it. I did it on the stage in 2007 using a cannula. I was so annoyed with Mertz when they did their protocol for the FDA. I go, why don't you ask the doctors who've been using your product off label, how do you
Right.
use it in the hands? And because it was a horrible idea to get it approved with a needle.
Mm-hmm.
And it was 4 cc's in a hand. That's way too much. You
Yeah.
don't need to do it, because they were using it as a space occupying filler,
Mm.
and they weren't realizing at that time its biostimulatory properties.
Interesting.
And so we were kind of nagging them about that at boot camp since 2007, but no one was listening to us. It's amazing that sometimes these companies don't, like I said, it's the doctors who are in the trenches really, really doing it. And Ted, sometimes those aren't the KOLs.
Yeah,
Sometimes
absolutely.
the KOL's expertise is from being a KOL. That's
Well, you hope that the KOLs get to that point because of their experience and not just because they were handpicked as someone that the industry likes.
it's political, Ted.
Mm-hmm.
It's who is in the
Mm-hmm.
mix and stuff
Mm-hmm.
like that. It's very political, and to the detriment, I think, of some of the clinical trials, because you don't have the. Now, listen, you got some great injectors out there doing great things, but
Mm-hmm.
we know inside who in their practice is really injecting and who's really not injecting quite that much.
Mm-hmm.
And the concept of hyperblending, now it started because originally Radiesse did not have any anesthetic in it.
Right. We blended it with
And
lidocaine.
so what I was doing was
Mm-hmm.
Mario Busso was the one who taught me this. It was his idea to add lidocaine to it. And that was right at about 2007. And what I did was want it to be more thinned out for the hands so I wouldn't get any lumps.
Mm-hmm.
And that's when I started hyperblending it 1-to-1 in the hands.
There you go. And now we're seeing hyperblended in the face to increase collagen production, increase
Exactly.
thickness of the epidermis, which we're seeing as well with Sculptra, right?
Oh, big time.
And I think that you really hit the nail on the head when you said, look, all I've been doing is Sculptra and some lasers and toxins and fillers, but Sculptra really, it helps multiple layers of the skin. And so that's why it's such a fantastic product.
Well, and so do the neuromodulators.
Yeah.
They improve skin texture too. And so I think what we're seeing now, because it's been an evolution. In '84, when I opened my practice, the reason I opened it was because in 1983, when I was a chief resident, I decided that I wanted to be focused on aesthetics.
Mm-hmm.
And in 1983, we were doing full face wire brush dermabrasion resurfacing, a bloody mess. But it was John Yarborough, who was the king of dermabrasion. He taught Patty, he taught me, and that's how we resurfaced until the CO2 laser came out in about 1994, 95. I started doing CO2. And the pendulum swung almost too much to the aggressiveness, and then it swung too much to the non-ablative, that it was not only non-ablative, it was non-effective.
Yeah.
So because it was so subtle of a result,
Right.
where are the results? So now we're in this really sweet spot where you can titrate the treatment by aggressiveness and number of sessions to the sensibility of the patient. So I have patients that want to be one and done, and I do aggressive resurfacing.
Mm-hmm.
But I have a lot of people who don't want to have as bad of downtime, and maybe they'll do one or two reasonably aggressive fraxels. And then I have patients who don't want any downtime, and they'll do a Claro 3D Miracle, or they'll do Clear and Brilliant,
Mm-hmm.
or they'll do something along those lines. So we really can cherry pick. And from the beginning, in 1984, I wanted to be able to do that. So I was doing wire brush, I was doing Zyderm and Zyplast, and I was doing 35% TCA peels. And I was taught phenol peels, but I didn't want to get into, in an office setting, the need for cardiac monitoring, et cetera, that you need with the phenol peels.
Right.
But phenol peels are amazing results. Marina Landau in Israel is the goddess of phenol peels. And I don't think I know anyone who's living who does more phenol peels and gets as outstanding results as Marina does. She's amazing.
I've watched a phenol peel. I've never done one, primarily for the exact reasons you've said. I know the results are amazing, but I have to agree I think TCA peels also, if you do them consistently, can give you incredible results. So if you're out there listening and you're thinking, gosh, these lasers are so expensive, which they are, think about peels, but not just your glycolic or salicylic acid. These TCA peels, 30%, 35% TCA peels, give you an incredible result. You just have to do them the right time of year with the right skincare around them, with the right person doing it for you. But they really are incredibly rejuvenating.
For young physicians, young dermatologists who are out there, because I teach a lot of residents,
Mm-hmm.
and to build a cosmetic practice from a business standpoint, you want to have a good ROI, which means you don't want to have a high investment.
Mm-hmm.
So I tell them, get good with peels, because
Mm-hmm.
peels aren't as expensive to the physician.
Not at all.
Get very good with the injections, because you pay as you go with the injections. When you get buy a big expensive laser, it's a year before you make that money back. And you want to avoid the syndrome of the hammer and the nail, is what I call it. And what I mean by that is, when a doctor buys a very expensive hammer, which is a laser, everything starts to look like a nail.
So true.
So, you want to be able to always put the needs of the patient first. what's in their best interest. Don't go for the quick buck. I tell people, look, if money is your focus, go to Wall Street, go into finance, be a baron on Wall Street. Don't be a physician. Physicians will make a good living, but they'll never make the money that the people do who are moving other people's money around and doing those kind of, I don't even know how they make money. They make money just when they're sleeping, these
That's
people.
right. No, I think you're exactly right. I've got two children who both want to be doctors, and I think it has to be a calling. Otherwise,
Yes.
if you do it for the money, you'll be sorely disappointed. You have to do it because you can't think about doing anything else.
Right. And unfortunately, to a certain extent, we're not scalable because there's only us.
Right.
And there's only two hands and only so many slots in the day that I can treat people and only so many years that I'm going to practice. So, I have to, you have to realize that, but it's a wonderful calling, and it is a calling because Ted, like I said, I'm going to be 69. I have no plans to retire. None, because I still enjoy doing what I'm doing.
Yeah. Somebody told me you have to tire in order to retire. And so if you're not tired, if you enjoy what you
Yeah.
do every day, there's no reason to, right? You
Yeah.
you mentioned, just going back, you mentioned Zyderm and Zyplast, which I remember that those were the first fillers I was trained on in residency, and those were bovine fillers, right? That's bovine
Mhm.
collagen. You needed to do skin tests for those.
Correct,
Oh
correct.
my gosh.
So, and we were skin testing once for years, and
Yeah.
then they had some people have delayed reaction on like their third exposure. So then they sort of mandated that you needed two skin tests.
I remember.
So we started doing two skin tests. So it completely eliminated the impulse buy, if you will. Because I'll tell you, Ted, in my practice, when I have a new patient consult, I would say it's about 90% of them get treatment the same day.
Hmm.
And they couldn't do that with Zyderm and Zyplast.
Yeah, it delayed that
Mhm.
gratification, didn't it? And
Right.
sometimes you wouldn't have patients come back because of that, right? Yeah.
Correct. Correct. So so the HAs were a big deal,
Hmm.
and the biostimulatory fillers I think are extremely important, and the combination of a what I call a biostimulant, because I have done several lectures on biostimulation, and I explain to patients and to when I lecture is, we all think biostimulatory fillers, i.e. Radiesse and Sculptra, but biostimulation is anything. Lasers are biostimulatory.
Hmm.
Peels are biostimulatory. There are peptides and exosomes and growth factors that are biostimulatory.
Hmm.
Retinoids are biostimulatory. I
Right.
mean, it's about upregulating those components of our dermis, specifically usually the fibroblasts, to produce more collagen, elastin, fibronectin,
Hmm.
chondroitin,
Yep.
hyaluronic acid. Because
Yep.
remember, the skin has hyaluronic acid in it, and you need that produced. So there's so many things we do now. I mean, I think when you get a good night's sleep, it's biostimulatory.
Yeah. No, I think you're exactly right. I mean, you make a really good point that even juvenile, I mean, any hyaluronic acid as you inject it into the skin can be biostimulatory. We can produce collagen. That's why I think we have patients who, for example, get their nasolabial folds done and it just lasts for 2 to 3 years in some cases. And I just
Yes.
think they are great responders to that expansion of the tissue, which causes collagen production for them. And they've kind of won the lottery because they without them knowing, their body is really responding to that filler in a beautiful way and producing the collagen that they have lost. So I think that's great. Another thing that we talk about in I don't do it. I don't know if you do it, is autologous fat transfer. Do you do that in your practice?
No, I don't, because
Yeah.
I don't do any liposuction. I inject, typically 4 to 5 patients an hour.
Okay.
I don't have time
Yeah.
to do that, but I am using the Renuva,
Yeah.
which is the fat matrix. Now, I've started using it, so I've been using it on the buttocks
Okay.
because what I'm finding is it works a little bit better than Sculptra and Radiesse to give a little bit more enhancement of the buttock. And that's an obvious place to use it because that's where you definitely want more fat,
Hmm.
for sure.
Hmm.
Because what's interesting about biostimulation of Sculptra and Radiesse on the face, even though we're using it to replace lost fat pads and shifting fat pads. They don't make fat. They have a stimulatory effect of the dermis that gives the illusion that deeper levels are being affected. So I'm very excited about Renuva, but right now I'm using it mainly above the knees
Interesting.
for that crepiness and
Yeah.
on the buttocks. But I want to mention, you mentioned about how there's biostimulation from hyaluronic acid. Did you know it was Voorhees at the University of Michigan who actually published the study, and it was the stretch theory of aging. And it was taking older fibroblasts and putting it in younger medium and vice versa. And when you take older fibroblasts and you stretch them in a medium with more youthful components of the skin, they sort of woke up.
There you
And
go.
if you took young fibroblasts and you put them with old, deteriorating matrix of the dermis, they went senescent.
Mm.
So the theory is that anytime you stretch the fibroblasts mechanically with a hyaluronic acid, some people will respond with biostimulation. So you're absolutely right. And I have people who have a phobia against Sculptra because they've read bad things on it on the
Yeah.
internet.
Right.
Because goodness knows, between 2005 and 2007, there were charlatans out there training anyone who had a pulse on how to do Sculptra, and they didn't train them well.
Mm.
And nodules and stuff were reported, and they weren't diluting it properly and mixing it properly. So a lot of people won't try it. Well, you can take and you can hyper blend HA and inject it pan facial. And I've done that. I did that on the Versa rep because I use Versa also, which is
Mm-hmm.
a filler from Canada.
Mm-hmm.
And naturally, she used to be a Sculptra patient.
Mm-hmm.
And she said, well, I want you to here's my product,
Yeah.
so I don't have to pay for the product.
Sure.
And I said, sure, but, I can't use it the same. And she had a very thin, gaunt face. So I hyper blended it and I fanned it with a cannula, pan facial, and it was exquisite results. I posted it on my Lupo Dermatology Instagram page.
Okay.
There was some people said, oh, that looks painful, but the cannula in and of itself is causing biostimulation.
Right.
Because of that. It's like a subcision.
Right. Right. Yeah. It's amazing how many things we do that lead to improvement in collagen that we don't even really, it's just in order to inject, we have to use the cannula, which in and of itself could be very beneficial. You mentioned Renuva, which I actually have some on my desk right here. Renuva is a cell-free adipose matrix. So it's adipose tissue that's derived from surgical specimen, and then it's processed in a way that it is cell-free. And the idea behind it is once it's injected, it causes the person's own fat cells to be produced and collagen as well. Dr. Lupo was saying she uses it in the buttocks. I've used it quite a bit in the face, and I enjoy it in kind of in the medial cheeks and to lateral cheeks in the face to replenish those fat pads as well. The issue can be longevity of results. That's the only thing that I found about
I
it.
think because we don't know.
Yeah,
We
we're
don't know
still
yet.
learning.
We're learning more and more about it,
Yeah.
but it's an interesting concept.
Sure.
And now, I don't know if someone taught me this little trick at boot camp.
Uh-huh.
And you were at boot camp, so I don't know if you picked this up, if you were there the whole time. Steve Fagan, who's an oculoplastic surgeon, who's an excellent injector,
Mm-hmm.
and he's a frequent speaker. He gave me the magic secret because he hyperblends the Renuva and he adds a little bit of HA to it. He adds a little bit of Juvederm to it because he says it improves the glide.
Yeah.
Because it can be hard to inject.
It can be, yeah.
So, I don't have super big hands, and these are the hands of not a young woman. So I don't want to get arthritis. So I have to be careful.
Yeah.
So I'm going to try it next time with a little bit of HA in the mix, just for a glide. And think about it, HA is a lubricant, right?
Sure, that's what it's meant to do. Yeah.
So you should try that too, and we'll compare notes next time we talk.
That sounds great. Well, we're actually out of time. Mary, I've enjoyed this so much. Thank you so much for being on and giving us your knowledge and your experience. And I thought it was amazing. We didn't even really talk about skincare, but I enjoyed learning about all of your everything that you talked about regarding toxins and fillers and the latest, from the latest to the most historic. It's been amazing. Thank you so much.
It was my pleasure. Well, we did it at your skincare summit, the Science of Skincare Summit. You had me discuss how I pair skincare with my injections. I thought that was a great idea. So I really enjoyed giving that talk.
There you go. We'll have you back. Well, thank you everybody for listening. This is Skincare Confidential. I'm Dr. Ted Lane. I'm the co-founder of Skincare Confidential. My co-host is Dr. Patty Ferris. We also are the co-founder and co-directors of the Science of Skincare Summit, happening this year, 2023, September 21st to the 23rd in Austin. Thank you for listening, and goodbye.